Hi there, diabetes fam. Welcome back to my channel, The Voice of Diabetes, the one and only YouTube channel that is helping you beat your diabetes together. So guys, on today's video, I'm going to talk about Trulicity. Yes, Trulicity is a GLP-1 receptor agonist. It's one of the GLP-1 analogs that I really like, and I'm going to tell you why, if you should be on Trulicity, and what you need to know if you are or if you're considering going on Trulicity. Guys, welcome back. If you are new, please consider subscribing to my channel so you don't miss any videos I upload here on a weekly basis. And please comment and share this video with others who might find this video helpful in managing their diabetes. We know that, not everyone is on Ozempic. We have patients on Ozempic. We have patients on Trulicity, whether it may be a coverage issue, whether it may be a pen preference, whatever the case may be. They're both really good medications, and I use these all the time. And of course, guys, I am not being sponsored by Lilly by any means. This is just an educational video that I want to share with all of you and give you my own personal preference and give you my own personal experience as well. And make sure you're tuning in all the way to the end, because I'm going to tell you how to get this medication if you are having issues with coverage or issues with affording this medication. So let's get started, guys. This belongs in a class called GLP-1 receptor agonist. In other words, we like to call them GLP for short. So GLP is a hormone that your body already naturally produces. Well, GLP is naturally produced hormone, as I mentioned, that actually gets released by your intestine whenever we eat. It communicates with our brain and tells our brain, hey, stop, I'm full, I don't need to eat anymore. It also keeps your liver from overproducing too much glucose. Our liver stores glucose and it releases it when we need it, because we need energy to function and to do and go about our day. So of course, in the times when we're not eating and in times when we are sleeping, the liver comes to the rescue and releases more sugar. Diabetics are already too sweet. They don't need more sugar and they don't need any more help from the liver. Of course, the GLP-1 receptors help with that. It also stimulates your pancreas and tells the pancreas, hey, wake up, buddy. I need some insulin so I can take care of this glucose that I'm eating now. And of course, the insulin is released and it takes the glucose and brings it into the rest of the body where we use it for energy. So that is, one of the very important things. In clinical studies, they realized that patients with diabetes have a weakened GLP hormone. Therefore, what they did is they said, hey, let's make a synthetic GLP-1 and we'll give this to type 2 diabetics, give it to the patient, and let's see how they react. Well, they were obviously very successful and very smart in doing so, because they were able to achieve a lot of these things, give these patients a prolonged version of GLP where they have this in the system for a week long. So yes, it's a once a week injectable. And of course, patients as a result see better glycemic control, lower blood sugar levels, and of course, some weight loss as well, as patients, their brain is telling them, hey, you're full, you don't need to eat anymore. And that is, that is obviously a great benefit. So you need to remember that this is not insulin. It's an injectable medication, because if it were oral, the acidity of the stomach would destroy this hormone and it wouldn't work. So that's why they had to make this into an injectable form. It's once a week. I like this pen in particular because it's very easy to use. It's already pre-filled, so you don't have to guess on how much you need to take, or you don't need to kind of dial up anything. It's already pre-filled. All you do is you remove this the gray triangular part. And then, of course, you unlock it. You go from the green all the way to the gray. You go to the injection site, which would be anywhere there's released fat tissue, in the back of the arm. You can use the front of the thighs. And all you do is you go straight in like this, and you push the button, and you get, this is a demo pen, obviously, and you get the medication. You can see that the plunger is going all the way down, and then you hear a click. Normally, I tell patients to count to 10. And then you throw it away. So it doesn't really require anything. And of course, you always store this in the fridge. However, for comfort purposes, I normally tell patients to take it out the day before, or at least an hour before. So that way, they're not going to get the discomfort of the coldness that you would removing it straight from the fridge and injecting it. If you do it that way, that's perfectly fine, as long as you're comfortable. But this is great for my patients who have a needle phobia, because you can't really see the needle, and you don't have to twist on the needle or do anything like that. So it's very easy to use. It comes in 4 different doses. We have the 0.75, which is the green, Then we have the 1.5, which is double of this. Then we have the 3 milligrams, and now we have the 4.5. So you're probably wondering, well, what's the point of all these doses? Well, believe it or not, guys, we are seeing better A1C drops, and we're seeing more weight loss with the higher doses. So patients are tolerating it and they're doing well. I would increase it until I reach the target A1C. Normally would always start at the lower dose, and then to give the patient some time to adjust, to make sure they're tolerating, they're not having any symptoms such as diarrhea, nausea, vomiting, and then I would taper the dose as needed, as I mentioned earlier. The general A1C drop that we see in clinical studies is about 1 to 1.5. I have seen more, guys, especially with patients who start to become more active and they're really watching their portion control. I've seen a much drastic drop than that, and I've seen a drastic A1C drop. So guys, of course, we always want to make sure that you're doing the most that you can as well. We can't just rely on the medications. Unfortunately, they're great, but we always want to do the best that we can on our end to maximize its effectiveness. I mentioned the cardiovascular benefit. We know that diabetics are increased fold for having heart attack, stroke, or any other cardiovascular issues. So this actually proved to be beneficial in reducing cardiovascular risk. So that is always welcomed, which is another reason why I do like Trulicity, because I know it's also lowering A1C, it's helping my patients with weight loss, but it's also providing cardiovascular benefit, and you cannot get better than that. So of course, I always choose a GLP or Trulicity in this case before I initiate insulin if I can go that route. We always want to maximize alternative medications such as this, along with diet and exercise before we initiate insulin, which can cause weight gain, obviously low blood sugars, and so much more. And you can watch that video. And side effects would be nausea, vomiting, diarrhea. Sometimes, guys, I'll go up on the dose and the patient may not be able to tolerate the 1.5 or the 3 milligrams. Personally, what I do is I give them a week until the symptoms are much better without taking any medications, and then I'll bring them down to the lower dose. So if they were taking 3 milligrams because I try to up the therapy, but they said, hey, Deanna, I'm feeling way too nauseous, what I would normally do is say, hey, skip a week, let the nausea and everything subside, and then I'll lower the dose to the 1.5. So of course, it's good because you can play around with the dosing when there is more dosing available. I don't like to have too many options when it comes to clothes and different things because it complicates my life. But when it comes to managing diabetics, the more options we have, the better. Because, hey, I want to have options because we know that not all patients can tolerate certain things. So the more options we have, the in better shape we are. Here, there is a black box warning with the GLP-1 all across the board. If you have a family history of medullary thyroid cancer, or if you have a personal history of medullary thyroid cancer, obviously we avoid this. If you have MEN2 syndrome, which is also very rare, then this is contraindicated. But otherwise, it is relatively a safe medication to use when needed, of course, and when we have maximized our lifestyle, such as dieting and exercise. So guys, let me know your thoughts, and if you have any more questions, please comment below and I'll gladly answer them for you. And please share this video with others that may benefit, and I will see you guys all on the next video. Take care.